things in my hand, I'm limited as to how many things I can do at one time when I'm shuffling. I want to take the opportunity to talk about a little bit of a storm that awaits us on the critical access side of the health system. And you know, where I came from, we were not a municipal hospital, so these sorts of things we would just talk. I would report to the board of directors. Our meetings were not covered by the media or other individuals. So you know, this notion of talking in executive session was not something we did often. However, as you know, we're guided by the public officers law, and there are some restrictions on what I can bring to executive session. So this is a topic that does not meet the qualification for executive session, which is why I gave a briefing to the Board of Managers. The briefing to the Board of Managers was somewhere between 35 and 45 minutes long last week at their meeting. My goal is, in a 5 to 8 minute span, give you a very quick review of one of our challenges that is forthcoming. And the reason I think that is important, behind you on the wall to the right here, you are seeing essentially the final drawings for the floor plans for the changes that we are proposing for the health system, and then you are also seeing the plans for how that looks on the current property. This project has to go through a certificate of need process, which later this month at the HHS committee meeting, I will give you a deeper briefing on this project, which will include the schedule and projected costs for the project, because I will need the Board of Legislators' support to move on with the process so we can complete the certificate of need, but also remain open to bonding the project. And we've been having conversations over the last 6 months or so, you know, with periodic updates on the project. Also keep in mind, I recently shared with my board the economic impact of Lewis County in 2019. Our economic impact to the county was $115 million on an $83 million budget. We generated 1,000 jobs. Our employees paid $49 million in, our payroll expenditures were $49 million, and the tax dollars generated by our employees contributing to state and federal taxes was $11 million. So this really speaks to our important role in the economic vitality of Lewis County, in addition to our most important role in providing health services. There are 2 other hospitals in the North Country that will be facing the same challenge we have, and that is Carthage and Gouverneur. And when you put the 3 hospitals together, the potential impact is $220 million. So healthcare is a very important part of the regional economy. So what is the challenge that we are working through? As you know, critical access was designated by CMS really to reduce the financial vulnerability of rural hospitals and improve access to health care. This designation was to help preserve access to health care in rural America. And Lewis County has benefited from that. Those who came before me recognized the wisdom of pursuing critical access, and the team there has proceeded and managed that incredibly well. However, like most things, there are criteria you must meet to be in a program or to have a designation. And there are many, but the one that has jumped up most recently that has us a bit concerned is there are mileage requirements between hospitals to be a critical access hospital. And Lewis County became a critical access hospital in 2014. In June of 2020, we must recertify to be a critical access hospital. That's a handful of months away from now. And up until 2 weeks ago, was really not something we thought much about. We're a deemed status organization, which means when the Joint Commission visits us, the state of New York and the federal government recognizes that survey process. That's very important. However, there was a subtle change made in 2015 which changed the designation of what is considered a primary road. And State Route 26 is now considered a primary road within the U.S. Well, let me get the exact language for you. State Route 26 is now considered a part of the National Highway System, which makes it a primary road. Now, in the critical access definition, a primary road stipulates that you must be at least 35 miles away from the nearest hospital. When State Route 26 was considered a secondary road, you only had to be 15 miles away from the other hospital. So we are 15.6 miles from Carthage Area Hospital. So we met the definition. But the definition, if it's changed to primary, we are not even close to the 35-mile requirement. And then Carthage to Governor, so you can see how we're all sort of connected with these mileage, with this change in road impacting the mileage requirements. So there are 9 hospitals in New York State that are impacted by this, out of the 18 critical access hospitals. 3 of us are in the North Country, and in the very near term must recertify. There are approximately 70 hospitals across the country. I can tell you that I'm a person who has a very positive and constructive relationship with Albany, specifically the Department of Health, and I have been incredibly impressed with how they've approached this challenge and how they are working with us in Lewis County and my colleagues in healthcare in other parts of the North Country to help find a resolution to this. So they have been terrific. And as I've reported to my board, I truly believe there was no intentional design to reduce the number of hospitals. I think there was simply clarification on a definition in 2015 without an understanding of how it would impact hospitals moving forward. And recently a hospital applied for critical access status and they were denied. This was one of the reasons they were denied, which brought light to the issue, which allowed the Department of Health to actively engage and bring the rest of us up to date on this. So this is important because when I approach you as our governing body, which would approve the bond, and we go through the certificate of need process, we have to be able to demonstrate our financial wherewithal to support the investment that would be made in this capital project. So I'm here to tell you tonight, one, I wanted to give you a briefing, much shorter version than I gave the Board of Managers, so you didn't let the word on the street influence you without knowing the facts. And 2, to let you know that I believe we will get to the other end of this and will be a critical access hospital for the long haul. But like anything, if you don't pay attention to the details and constructively work to make the change, then we could be on the short end of the stick. And I am very optimistic working with Haney's, working with Iroquois Health, working with the other 17 critical access hospitals, and specifically the 8 who are impacted. We will successfully change this sub-regulation that was modified in 2015 that just came to light. So I really wanted to be transparent with you, let you know what's going on, but I feel like we have a good handle on it and are constructively working. I would like to say it's the #1 priority that I'm working on, but that wouldn't be fair to the other projects and initiatives that we have going. I would say it's in the list of the top 20, and on some days it is all of the focus, but then there are other days, we have to allow the process to work, and then we sit it back a little bit. So, are there any questions?
Yes.
Okay.
How does Carthage building a new hospital affect that with their location? Would that be within the 15.6 miles?
Yeah, I really can't speak to that because my conversations with Carthage have been strictly on this point. And I haven't asked, nor have I been briefed on their project. I know it's out there as a plan, but I'm not aware of, I truly don't know the details. So, yeah, it would be conjecture, not grounded in fact.
That happens a lot with me. But it just seems like it would be closer than their current location, and that's the reason.
No, I actually think it's a little further away from us than the current hospital.
Okay.
You know, it's going to be out near the high school,
Right.
and so that's a little bit further than the 15.6, but not by a lot.
We should also point out that if they get too close, they jeopardize their lives. They can't get
That's a
within
good
50
point.
miles.
I didn't think about that.
So I'm sure they're gonna make sure they're more than 15 miles away.
So your words were just a little bit of a storm. What would the dollar impact be, or don't you want to say?
No, right now it's projected, with the help of the Critical Access Health Network, which is a group that comes together quarterly, and it's amazing. Critical Access hospitals share lots of information. You share financials, you share quality data, and so through that group, we were able to get that number for each of us. Lewis County's number is $5.3 million projected annually. That would fundamentally change the services we could offer and could potentially impact our long-term viability. So, you know, Dick reported we did a little better than budget this year, which was good, right? We exceeded our budget. But let's be honest, Dick, that number was
191,660.
on an $83 million budget. So the team is doing a great job paying attention to the financials. We've saved a little bit of money because of the hard work of many, but when your margin is that narrow, $5.3 million is a bit of a storm.
That's a bit of a storm. Yeah.
Right. But it's a storm that is manageable, and because we're constructively proactive, and there's no finger pointing, there's no blaming, because there's a fundamental belief that no one intentionally meant to do this. They were clarifying some definitions, and somebody at a low administrative level just followed the rules and denied a hospital that requested critical access. So now let's work on changing the sub-regulation, and that's where we're putting our energy.
Actually, when you compare 5 million to 83 million, I guess it is a little bit of a storm versus just
Right.
looking at $5 million.
And the 83, keep in mind, is not just the hospital. It includes the long-term care facility, it includes home health, it includes hospice, and the physician practices. So, and the hospital is just one portion of many service lines that make up the 83 million.
Thanks.
All right, well, thank you for your time. And if you have any questions, please, you can reach out to Ryan or myself, and we'll get you the information.
Thank you.
Thank you.